Hi, my name is Serena Patton. I am a nursing student from Nightingale College. Today I'm going to perform ophthalmic medication administration. I have my supply here. I have washcloth, clean tissue, 2 sets of gloves, eye drop, and my patient. So before I'm going to start, I'm gonna verify the doctor order, and I'm gonna verify the 6 right medication administration, which are right drug, right patient, right route, right dose, right time, and right documentation. And I'm going to open the EHR to see if the order is there, and then I'm gonna check the medication against the order. And it's look like that the doctor ordered Temolol 0.25% solution to instill 1 drop in each eye for 2 times a day. And I'm going to gather my supplies and going into my patient's room. Knock knock, open and close the door to provide privacy for my patient. I'm putting my supply on a clean surface area, and I'm going to introduce myself to my patient. Hi, my name is Sirinut. I am your nurse today. Can you tell me your name and date of birth, please? All right, thank you. So after I am checking his armband while he's telling me his name and date of birth, so I see it's a same person and it's the right patient for the right medication. And this is a good time to check that right patient and right medication, which we need to check it for 3 times. And this is my second time to check that. So it's look like the doctor ordered you the eye drop Temolol, the medication Temolol 0.25% to instill in 1 drop in each eye for 2 times a day. Are you okay with that? Okay. So this medication used to treat glaucoma and other conditions that cause eye pressure in the eye. And the medication is beta blocker, which works by reducing fluid in the eye. Do you have any question? No? Okay. So do you have any medication allergies? No. Do you have any seasonal, environmental, or foods allergies? None of those. All right. So this medication has side effects, which some common side effects are itchy, temporary blur vision, redness, dry, and watery eyes, and some adverse effects like dizziness, irregular heart rate, and eye pain and swelling. So if you have any of those symptoms, please let me know immediately. And for some patient who for some patient who once applied this eye drop may have sensitivity of light and stinging. So if you have that symptom also, please immediately report it to me. Okay? Alright, so I'm gonna lay you down into the supine position and make you comfortable. So I'm gonna ask you to tilt your head back and look up when I'm instill the medication, okay? I'm gonna raise the bed to the working level, and I'm gonna lower the side rail down. I'm gonna perform hand hygiene, and I'm gonna put on gloves. Okay, so I'm gonna use a warm washcloth to clean your eye. It's gonna be motion from inner canthus to outer canthus on both eyes. And if I see that patient have the dry crust, then I will use the warm washcloth, put it down to soak it for a few minutes to let it soft and clean it so that it's gonna be easily cleaned off. do not scrub patient eyelid. Okay, so I'm gonna use this warm washcloth, wet warm washcloth to clean from the inner canthus to outer canthus and change position on the cloth. Inner canthus to outer canthus, and dispose this washcloth with gloves. I'm gonna perform hand hygiene and put another clean glove on. Okay. So I'm gonna use my non-dominant hand to fold this tissue and put on the bone cheek of the patient, just right at the lower eyelid. And I'm gonna use my thumb to pull downward to expose the conjunctival sac, but make sure that do not put the pressure directly right into patient eyeball. And then I'm gonna use my dominant hand, open the eyelid. I'm gonna rest my dominant hand on the patient forehead, and I'm gonna holding the fill eyedropper above the conjunctival sac about 1 to 2 centimeter. And then I'm gonna instill 1 drop into conjunctival sac. Can you look up? Can you look up, please, so I can instill the eye drop? So 1 drop into conjunctival sac. Thank you so much. And can you not blink or close your eye, please? Otherwise, the drop will land outside the lid and we have to repeat the procedure, or I will have to reapply another drop. Okay, thank you. And for administration drug that have the systemic effect, I will use the clean tissue to put on the nasolacrimal duct, put the gentle pressure on it for 30 to 60 seconds. Okay, and make sure that do not press the pressure directly into the patient eyeball. And can you close your eye or blink your eye gently and briefly, please? Perfect, thank you. I'm gonna discard this tissue into the trash receptacle, and I'm gonna repeat the procedure. I'm gonna use my non-dominant hand right at the lower, pulling downward to open the conjunctival sac, and use my dominant hand on rest on patient forehead, holding above the conjunctival sac 1 to 2 centimeter, and look up, please. Instill 1 drop into conjunctival sac, and ask patient do not blink or close his eyes. And also use the clean tissue to press gently on nasolacrimal duct, but make sure not put pressure directly on the patient eyeball. And ask the patient, can you close your eye or blink your eye briefly and gently, please? Perfect, thank you. Discard it and discard everything into the thread receptacle. Remove glove. Washing hand. And I'm gonna raise your head up. Tell me when. Okay, I'm gonna raise the side rail up and lower the bed down to the lowest position. So are you comfortable? Good. Here is call light. Please let me know if you have any questions or if you experience any symptoms of those effects, side effects, and adverse effects. Okay. All right. I'm gonna go out and document the procedure. Okay. Perform hand hygiene again.